Hi, friends, and welcome to Midwifery Wisdom Reacts. This is Leila, Bekah, and we have a new guest speaker today, Elke. Augustine is out right now, so we're still reacting to amazing videos out there on the internets, right? We've got our reality TV shows, vlogs, as well as beautiful birth scenes from midwives and birthers around the world. So please be sure to subscribe and like for our photos so that you can make sure that you get updated on all of the new Midwifery Wisdom Reacts as we go. Ellie, tell us about you. We can't wait to have you on today and hear you react to these amazing videos.
Hi, so I'm Elke Saunders and I'm a midwife from Kodiak, Alaska. And I've been in maternal child health for a long time, since the mid-90s. I've worked in research and lactation and hospital-based doula, childbirth education, and then I became a midwife in 2012. And I had run a small kind of boutique practice on a remote island in the Gulf of Alaska. And I started a birth center about a year and a half ago. I started, and so that's what I do.
Awesome. Love that.
And I met Augustine at a workshop a couple years ago, and we've stayed in touch. And so I'm really excited to get invited to fill in for her today.
Yes. I love that, a boutique.
Everybody knows Augustine, right? Like everybody knows Augustine. How many times can we just drop the Augustine name?
The
Subscribe, Augustine, like Augustine.
Okay, well, we've got a few cool births we're gonna react to today. I think this first one is from the show 16 and Pregnant. So let's do this, guys.
She's Coast Guard, yeah.
I started wife. Yeah.
And my water broke last night, and the pain is already unbearable.
I'm never having sex again. I regret it. I'm not gonna be able to do this. I'm gonna end up at the hospital.
Since my contractions are getting closer together, my doula says it's time to come into the birthing center.
I personally hate the comment, my doula says it's time to come to the birthing center. I'm like, it's not your doula's responsibility to bring you in on time or keep you home until it's time, but
okay, I can't do this anymore. I need to get me to the hospital. I think I'm dying.
I just wonder why she's on her back.
Shut up.
probably just
I can't do it. Oh my God. I can't.
She's still on her back.
Let's do the bath, and that's going to help relieve some of your discomfort, okay?
That's a tiny, terrible, tiny tub.
It's a shower tub.
It's horrible. So she's
Like
again
it's shoulder,
on her back. She's
like,
on her back.
And let's talk about resolving a shoulder dystocia in that tub.
It's not going to happen. Or just seeing what's going on with her body, you know, because you can see so much about what's going on with the baby and the body by how they move, and just actually visualizing the pelvis from the outside. So you can't see anything. You don't have any information. And she's been on her back for 3 hours already. So if the baby does need to turn, it's really unlikely, you know, it's harder for the baby to turn, and she's going to be miserable. So I don't know.
And it requires her to stay in this position too. Like there is no like squatting or like hands and knees. Like it's a really funky size. Bekah, did you labor in the tub?
I did not have time. My labor was 2.5 hours and I didn't start contracting till I was like, or having like intense contractions till I was like a 6. So I didn't have time. I didn't want to move. I couldn't even lift my leg out to get into a tub at that point. But I did try.
For both of your births?
With my first, I did try. I'm really tall, and I was trying to kneel. I didn't want to like lay back at all. I tried to kneel, and my knees and legs kept going numb. So it was super uncomfortable. So I was like, get me out of here.
So because we're watching this person do this, like, why didn't you want to lay back? Tell us more about why that would be really challenging.
I mean, like, I didn't really think about it in the moment. It was like a natural, I don't want to go that way. But like thinking about it now, I needed to like be able to like hold on to something and like have power and like feel grounded when I went through. And laying on my back, I would have just been like writhing in pain, not able to like, you know, center myself. So I just saw her laying on the bed and I was like, ow.
Exactly.
Well, and the other problem with this tub is you really don't get pain relief unless the water is over your tummy. Like to get the real pain relief, you need the water at least over your belly.
Yeah.
And the deeper it is, the more pain relief people get. And then also the ability to move, to just let their body move. And it's just so bad. Yeah. Because it looks even less comfortable than the bed, because now your top half of you is probably cold. The bottom half is warm.
Yeah.
You can't, and then now you're stuck. You're like, it's like being in a cast. Yeah. And then it'd be really hard to get out too. Like you were saying, as far as if you needed to get her out, it would be challenging to get her out.
Yeah. Or do any type of Gaskins or McRoberts or hands and knees or running start or
just
anything.
Seeing what's going on, because sometimes you can see, just seeing the introitus if you can't see the baby's head coming out, or just, anyway. Yeah. It's all bad. We agree. Bad tub, okay. Which is like, I hate to be critical of another birth center, but it's like, that's one of the main things that draws people to a birth center. One of the big things is people want a tub. People want a big tub. Like that's one of your main.
I want a corner tub that's got all the bells and whistles. Yeah. And it's huge.
That's the whole point. Not the whole point of, and I just use inflatable tubs just for cost reasons, because it costs, where I live on a remote island, and it costs me thousands of dollars to get anything shipped here. And so we use inflatables, but I have 3 different ones, and a big one and a small one and a backup one, and then an amazing shower, because that's what we have. One of the major things that we have that is better than the hospital. And so it doesn't make sense to me that they wouldn't just buy an inflatable tub. But the other thing here is, I know some midwives that really don't like Waterbirth, and so they intentionally don't have good tubs to discourage people from having their babies in the water.
Yeah. My face shaking and nodding and agreement, and Bekah's face like cringeworthy gross, is just like the truth, the fact. I had someone recently say, I don't do water births, so when it's time, you're going to get out of the water. Mm-hmm. And it was just like this very, very, and this was at a birth center.
Right.
And this was just like this very interesting moment where, as the doula, I'm kind of like, are you comfortable here? Would you like to stay in the tub? But also, like, is there a medical reason for you to get out of the water? Right? Like, am I, as the doula, getting in the way of a dangerous situation where we need to get out of the water? Or am I dealing with a midwife's priorities over her patient's own, And it was really sad. It was really strange. And then later on, kind of just hearing like, oh yeah, I just always like, let them labor, and then come up with some excuse or some reason why it's time to get out of the tub.
Yeah, that sounds a lot like hospital practice about that. Oh, you can give birth in any position, but then no matter what, they always find a way to get them on their back with their, feet up in the, in the stirrups or on the squat, whatever. And they get the whole bed set up. Okay, here you are. And they'll be like, I want to, no, don't roll over. I want to. And watching that whole scene, I doubt it's that extreme, maybe not. The midwives I've worked with that don't like Waterbirth are upfront with that from the first prenatal. They just say, I don't feel comfortable. It's hard to resuscitate. It's hard for me to estimate blood loss. We don't want you to have your baby in the tub for these reasons. And this is our practice. And I think that's one thing to like be really upfront. That's like your comfort level as a provider, but it's completely different to do the bait and switch.
Yeah. Absolutely. And, I think, do you see correlation with older midwives and no birth tub? Like it hurts their back to lean over the birth tub and they just don't want to deal with that?
Yeah, I do know one that's like that, one that's older, and another person, some people that are more, they don't like they're more like, I want to say germaphobe, but they don't like the germy factor of it. And then other
like you
ones,
can't glove up because it'd be like wearing a raincoat in a swimming pool, right? Like there's
right,
not a lot of that.
yeah, they get skeeved out by all the floaters and things like that. And you know, I put a lot, what I'll do is I'll put a lot of Epsom salt, like pounds of Epsom salt. So we're basically talking it's salt water, which helps keep, you know, any bacterial growth down. And so there's ways to work around that. I change the water all the time. But a lot of the other midwives I know, they don't like the resuscitation, that, you know, the time it takes, if the baby and mom need help, it takes longer because you have to get them out, and then they're cold and they're wet. And the resuscitation part, they're really uncomfortable with, like, having the baby on the mom. And, you know, some people are fine with that and, you know, doing a resuscitation like that, but other people, they want the baby, you know, on the resuscitate cradle with the heating pad and all their equipment. Yeah. So I think that could be that's another reason why people don't like the tub.
Yeah. So moral of the story, if you walk into your birth center and you see a tub like this, talk to your midwife about their comfort with Waterbirth.
Well, or even with a good tub, like ask them, you know, like what percentage of people give birth in the water if you really want one, you know.
Great idea. Ask what's your percentage, just like when you're talking to a provider in a hospital, what's your cesarean rate, what's your episiotomy rate, right? Like ask what their water birth rate is. Good idea. And you want to, what's the bets that she delivers in the water?
I don't know. I doubt it.
Yeah. Okay, we're all like not on. Okay. We don't think this is gonna happen.
Let's see what happens.
I just want to see where her head's at.
Call an ambulance or something. Please. They're not going to be like, I'm just saying, please.
I remember there was a point where I was like, I don't think I can do this. And I got close to wanting to be like, I want to tap out. And I would have hoped that the people around me would have listened and trusted that I was saying what I needed and wanted. And I've heard her say multiple times, I want to go to a hospital, call an ambulance. And I feel like it's kind of being glazed over. And
they're completely,
I was going to say, I think that there's a big difference between like keeping someone from leaving and supporting their initial desire to birth out of the hospital, because I agree with you. I was one of those people. I'm a real dramatic birther. I'm like, I'm dying. God save me. And I'm like, fine. And I look back and I'm like, oh my God, that was an orgasmic experience. I'm like, no, it wasn't. Right. I was screaming. But if someone had said like, you say it, we go. Like, I don't argue with that. Right. That would have been detrimental to my birthing experience. But I've been at births where we've looked at the person in the eyes and said, your vitals are normal. Your baby sounds great. You're making amazing progress. You can do this. And they said, I don't want to. Mm-hmm. And so we set the expectations. Mm-hmm. Okay, there is a 45-minute drive to the hospital. Once we arrive in triage, it'll take about 30 to 45 minutes to get into a triage room, in which then you need to get one full bolus of IV fluids before you see the anesthesiologist for an epidural. You're 8 centimeters. By the time all of that occurs, it's possible you'll already have your baby in the car on the way there even. Can we talk about some alternative methods here? Can we try different positions? What are your thoughts with there? Can we think about maybe just 10 more contractions, 1 more hour? Or is this really intuitively what feels right to you? And they're like, I need to go now. They are informed, right? They're informed of, and then we also give them the risks of epidurals, risks of transferring, risks of staying, right? All those things too. But I mean, if they know that they're not transferring because they're unsafe, like in a sense of like vitals and baby and things like that, that they understand that they're not going to arrive and like walk in the door and get an epidural, right? And that they understand that we're not holding them captive. Mm-hmm. Then they decide to go, like they should go. That's like abuse.
Yeah. Mm-hmm. Yeah. And maybe,
but I also agree with you though, Bekah, like if someone had just said, okay, How
Well,
many
and I
births?
think a lot of this is like prenatal preparation. Like I've never, I mean, I'm trying to think if I've ever had anyone say that
Yeah.
like she is. It's just, to me, it's just like, oh, she's not prepared. She just hasn't bought in.
Right.
She hasn't bought into wanting to be here in this birth center.
Yeah.
And I probably would have risked her out way before birth, because I tell people, you need to be 100% on board. Like, this is what you want to do.
Mhm.
And if that's not 100%, and that's different than when you're in transition, you're like, I can't do it, because I did the same
Right.
thing.
Yep.
Like
Right.
okay, so I had a home birth that was 45 minutes. One of my first home birth that was 45 minutes from a hospital. And I was in the tub. And every time I got out of the tub, it went from like an 8 to a 10 on pain. And then so I go to the bathroom so quick, and then I get back in the tub, like, oh. And then I remember we had the Suburban at the time. And I remember thinking in my mind, so how do I get the birth tub into the Suburban so I can ride in the tub to the hospital to get my epidural?
Can you imagine?
And then a baby came out.
And then a baby came out, right? So I'm not
Right.
saying that people don't say I can't do that, but
Yeah.
usually what they'll say, my clients at least, will be like, I need something for the pain. Isn't there anything for the pain? And then they have their baby 20 minutes later or something.
Mhm.
No, also that's just transition. But to me, my impression of her is that she's not properly prepared for this experience. Between
Does
not
that feel right to you,
moving-
Bekah?
Yeah, not moving, not knowing any coping mechanisms, and they're really not doing much for her, is kind of what I see.
And I can't imagine having a baby at 16 years old. Like, I was 25 when I had my first, and I still felt like I was like, and so she's already going through a big experience. So
Right.
having a
But
birth center
you
birth would
would
be something
think,
that I really had to like prepare for and be
Yeah,
informed.
really lots of education.
right, childbirth education,
Lots.
doula,
Lots.
understanding the spiritual, emotional, and physical commitment of what's happening in your body and your mind and your heart and your birthing moment and your baby.
I can't fill in
Well, don't say that to her. I would feel so disheartened right then. Oh, I'm back again.
Down to your bottom, down to your bottom.
You can do a medicine.
I got your leg, honey.
Oh, this is painful to watch.
You pushed her right on out of there.
That's how she was born.
My labor and delivery were the hardest thing I've ever been through. It was awful, but it was worth it.
Aw, that was sweet.
She was
I'm
placed
glad that she added that, because her face postpartum did not look
more, but
oxytocin filled. You know?
Mhm. Yeah. I think she called it I don't wonder if they bleeped out what she called it. That's
Yeah.
kind of sad.
I mean, I think you're really accurate, Bekah, with that comment of like, she's 16. She's 16 in America and had a baby at a birth center.
It's a big
Right?
deal.
It's pretty badass, honestly.
Yeah, that is. I just
But
think
she's
they could
really
have
like a
made
16-year-old kid.
No, they definitely could have made it like easier on her had she had like some hypnobirthing. Like
Some hip
hypnobirthing.
squeezes every once in a while.
Yeah.
Great.
Hypnobirthing and like more directed positioning, like, okay, I want you to get on your left side and we're going to push on your back and it's going to help you feel a lot better. Like, I think I would have been more bossy about making her move and get more comfortable. And I would have been more of a doula thing. This is a lot of the doula experience, because a lot of midwives don't have doula experience. So like get right in her face and like talk her through every single contraction and tell her every single one, look, your baby's one step closer, one step closer. You're doing so good. This is amazing. You feel that pressure? The pressure's good. Or like when she was just screaming, you're like, you're stretching beautifully. The head's coming out beautifully, stretching. Oh my goodness, look at you. You're doing such, and they were just very much, and it also kind of reminded me of a hospital birth. Really, I wonder if those midwives were CNM hospital trained or something, but I couldn't believe that again, she's pushing on her back with her legs back. And I just I'm disappointed in the care she was given. I'll just say that. And like, she definitely could have at least used a doula to make that
and that goes to kind of to some things that we see a lot is you can tell, and I mean, I'm making a big assumption here, but from my point of view, it looked like both mother-in-laws were there. I mean, both mothers were there. Sorry, mother-in-law and her mother. Your mother is not a doula. Your mother-in-law is not a doula. Right? So like, I hear this a lot. Well, my mom and my mother-in-law are coming, so I don't need a doula. Right? So
you really need a doula in that
situation. You need two doulas.
Yeah.
Because you need one person to keep them out the room and one person to rub your head. So yeah, I think that was probably where that came from, because she did have there's a lot of people in there. Her partner, her mother-in-law, her mother, a midwife, and it looks like a midwife assistant, a birth assistant, or a senior student midwife.
Right.
And the mother and mother-in-laws were not doulas, and she should have had a doula instead, or on top of.
Yeah. Well, and what do you think of, it's interesting because I know like when I first started training, I had the doula beat out of me. They're like, quit it, stop being a doula, stop doing that. And I don't agree with that now, because if you have like, I practice with a nurse, a student, and myself, and the nurse and I will both take turns doing doula role. And of course you can't really doula them the whole time, but it just makes the birth so much better, like so much better.
Yeah, that's a concern of mine for sure. So any student midwives that are watching, like if you've been a doula before, I know that you're probably asking this of yourself too, but I've like made a commitment to myself, and every day I think about it, but I'm just like, I do not want to be that midwife that sits on the edge of the bed like this.
Oh gosh. Oh my gosh.
You know them, right?
I know them.
And so this woman is screaming and she's like this.
Oh.
And like, I cannot be that person, but I've had midwives tell me like, how are you going to be well rested and of the frame of mind to suture or resuscitate or deal with a shoulder dystocia or a problem if you've been hip squeezing and verbally guiding through each contraction for 18 hours?
Well, that's true.
Right?
That's true. And I tell people that. But the thing is if they get good support, it's not going to be 18 hours, it's going to be 12. Because if they get good support,
we spin the baby, we make sure the mom's balanced, she's well rested, fed, watered. Yeah, exactly.
And I think part of that comes from high volume practice too. And one of the reasons why I like to have a smaller practice is because if you have 11 births a month, or even it depends on how much other things you're doing as a midwife at the birth center, but if you're having day after day after day of clinic and birth after birth after birth, you just don't have the emotional bandwidth to be there for them.
Yeah
And I guess that's something that also a birth center is going to generally have less personalized kind of attention, but then so that's something to consider. And then also the kind of people that are attracted to birth center tend to be less prepared and less foundationally prepared.
Because people see it as like a in-between.
Right. And it's like they still see it as the place where you go where the people deliver my baby, rather than like me and my body are going to do this. And I have to figure out how to get this baby out and not scream at them to get it out for me, because I know I have to get it out.
Yeah.
So and that was one of the things when I started a birth center, I knew full well, it's like, I'm going to attract a whole different kind of clientele. And that's why I screen pretty strongly for people, because they'll have that in their mind that this is the place where the babies are born.
Yeah,
And
that's really
interesting. Where I'll be delivered.
That's really interesting you say it like that. I never thought about it that way. I always just hear this comment of like, well, I did that because it felt like a good in between. It's not home, but it's not hospital. So like it keeps my partner happy because it's not home, but like I'm happy because it's not the hospital. Right. And I'm like, in some states, the state that I'm in now, it's no different than a home birth. Like with your example, it's a little different, right? Your fishermen like came in, they didn't have a home, it's kind of like a thing, right? But like in some states, it's literally a home birth, not in your home. So why are you doing this? Other than maybe your insurance covers birth center, not home birth. You don't have a home, or your home is over an hour away from a hospital,
or an
right? Like, an unsafe place. So that usually tends to be the reasons, but there's that unspoken because they're not fully committed question in there too. That's interesting. Bekah, you kind of had a funky situation with your last birth on finding a midwife last minute or something like that, right? Were you considering a birth center? Like how did that end up for our listeners? Because I know we talked about that last time.
It was. Yeah. So just to recap. So my midwife lives whatever, 3 hours away. And over a mountain pass. And normally, you can make it the other way around is like 5.5 hours. And it was summer, the pass was supposed to be open. There were fires, it closed. So we had to that was at like 36 weeks for me. So we had to do some last minute kind of trying to figure it out. We considered a birth center here, but weren't super impressed with the care we would have received. We considered a hospital that, has midwives that still help you have the best experience you can have. We ended up driving to the midwife's house and staying there and having my baby at her house.
You drove to the midwife that's 5 hours away?
The pass opened back up, like there was a short window, it opened up, and we just jetted over and stayed there till I had my baby.
When did you stay there?
When
did you go? I mean,
we went a week before I was due, and he was 4 days late. So we were there for a little while.
Wow, good idea.
And so it felt really crazy. And like in the moment, I was like, but I wanted to have my home birth. I wanted to be in my home. But looking back on it, I was still able to have the home birth experience that I wanted. And we stayed there for a while. So the area that we were in came to feel like home, and we were with family, but it, there were a lot. It
was a birth center though, in a way, right? Like, and you made it feel like home.
Yeah.
No, but it was at her house though. It wasn't at a birth center.
So it was a little less clinical.
There's a big difference because of all of the, at least in our state, or someone that has licensing requirements for a birth center, you have mountains of regulations and paperwork and protocols. And it's like, I'm not allowed to have, I like to make little Dr. Bronner's, home soap, like, foamy soap dispensers or whatever, but I'm not allowed to. Everything has to be like, bleach and Lysol. And there's like all these requirements about which things I can use. You can't use On Guard, there's all these, or that's a gray area. And if you get inspected by an inspector that doesn't like On Guard, then you have to switch to all bleach. I mean, it's just like all of these like regulations and things at a birth center. Like you're only allowed to stay, I think if you stay over 24 hours, if someone stays over 24 hours, you actually have to make a report to the state about why they stayed over 24 hours. You either have to send them home or send them to the hospital. So it is different, like having a birth at a midwife's house than an actual birth center, because of all the, it's a facility, it's a licensed healthcare facility. And there's so many rules and regulations that.
I love that. idea of having a birth at the midwife's house. I don't know what is so romantic about it, but like
that's really cool.
Yeah, and it's a
real
little
silly
different.
romantic.
My sister-in-law, so it was like staying with family. You know, it's not like just my midwife that I only have this professional healthcare experience with. But it was to like, because the night before he was born, I had what I was having contractions every now and then all of a sudden they started like lasting so long, and it was like gas stuff going on, but I was able to call her in the middle of the night and she came right up to help me. So it was really nice to have her right.
Yeah.
And feel my belly every day, and I could ask her every question I had, and it was
I'm sure she loved that.
Romantic. And and then they got to have a baby in their house for like a week.
So that's nothing like a typical birth center experience. So, and I don't mean to be all down on birth centers either.
No,
because they do serve an amazing purpose, like we're saying, for people who don't have. And then also there's this like, it's not necessarily a bad thing if somebody wants the in between because they're just like culturally not there yet, but often they become super convinced. And I know, I don't know if you had this experience in your doula world where a lot of people, like their first birth was at the hospital and their second one was at the birthing center and then their third one was at home. Or especially people who have lots of babies, they'll have a bunch of them and then they're like, why did I even go to the hospital the first place? So it's not, it takes time for people to progress to the comfort level of realizing, wow, actually I can do this.
Yeah. So to circle back to this, like this girl's 16.
She's 16.
First birth. Shows an out of hospital experience.
Yeah, it's
right. Like as cringeworthy as her screams were, because that's so strange for like most of us who are like helping very prepared birthers. She made some decisions that first time birthers don't usually make. At 16.
Yeah, that is amazing.
So props to you, girl.
Hear about her story of how she came to that point.
Yeah, me too.
Yeah. Are we ready for the next one?
Next one.
Let's do it. Oh, look at her like holding herself up.
I know.
Sit down.
Arm straight.
So this looks like it's maybe in a hospital or a birth center.
Yeah, they have those birthing units that are run by midwives and they don't have all the technology. It's like a midwifery led unit in a hospital.
Yeah, look, there's a big tub over there.
Yeah, or they can actually have the same technology as a birth center here. So that's a nice tub. This is a good contrast. Compare and contrast. Oh, and here goes the
nitrous oxide. Okay. Oh, I thought he was trying.
I thought he was pulling off it too.
Is that a neck pillow, I think?
Honestly, that happens a lot. Like in between, dad takes it and he's like, I need a little bit.
That's so funny.
Well done. Well done.
Oh, that mellowed her right out.
The skin down below is looking a little bit tight. Now, if she doesn't come with the next one, I might want to think about getting you out just to see if I might need to do a little cut.
Just cut it.
I can't do it in the pool, and I won't do it without feeling to see how much room there is. It may just be that she's just going to take a little while to crown. Do you want to try a different position? Do you want to try kneeling? Okay, well done. That's it.
Well done. Well done.
Those are some professionals.
Oh, Donna, you're doing so well, sweetheart. You're doing so well.
Have a breath.
I can see her head.
Oh, help me.
But they were talking about an episiotomy just now, right?
Yeah.
Keep going, sweetheart.
Yeah.
Yeah. She was like, well, might need to get you out to do a little cut. I mean, I know that this is obviously like production quality filming. So they obviously cut and started over again, they paused, started. So I don't know how long it's been, but that seems a little hasty. I mean, she may have been crowning for like 45 minutes. Like, we don't know, but that seems a little strange that, and I don't see them listening to heart tones. So, what's the urgency?
Well, I think, like you say, they may be editing it out.
Right.
because they've got the long gloves on, and you know they're using that for when they're in there listening. I don't think we're seeing the whole clinical picture here. But I must say, in contrast to the previous video, I really like the way they're speaking to her, even though I may be cringy for people, her calling her a girl, you know, that could be a little cringy. I wouldn't say that, but I just really like they're very kind in the way they're explaining things very calmly.
Yeah.
Cringy when people say like, that's it, good girl.
Yeah, exactly. Hey, let's try rolling over. I didn't hear any of that in the last video, like suggestions.
Well done. John, I think we need to get you out, sweetheart. You have to, sweetheart, at this stage. It's really important. She's coming, darling. She's coming, sweetheart. You're doing so well. Come on, darling. Try pushing to your bottom for me. Push
Come on, you can do this.
Come on, John. You are so close now. So close. And breathe. Breathe. No, and a push for me again.
And a push, and a push.
All right, sweetheart. All right, keep coming. Cut it out, please. Help.
Well done. That's it.
Brilliant. Come on, darling. Come on. Push.
His head out.
I can't tell if it's the glove or if that's the baby's head.
You can go for it. She'll come. Well done, darling.
I keep seeing like a purple.
That's the head. I bet.
She's coming. Excellent. There you go. Donna, she's coming.
Oh, no.
That's the dance. She's here. You're just going to like you can go with me. There you go.
When they were getting her out of the tub, did they say the baby's not coming, so we have to get out, or the baby can't come here? Did you get the impression it was like a protocol, you have to get out because the baby can't be born here, or the baby's not coming in the tub? So
Becca, will you go back? Because I thought that they said the baby's not coming, so we need to get out of the tub. And like this position isn't working, you know, which again, we don't know how long it's been.
Right.
It could have been an hour at rocking and crowning and moving and flipping, and because she did a lot of positions in the tub.
Yeah, well, and that's pretty common. Can be common, especially first time moms. They have a hard time pushing in the tub, you know, like you just don't have traction, like the gravity actually helps you, so that could be what she needed.
Well done. John, I think we need to get you out, sweetheart. You have to, sweetheart, at this stage. It's really important. Donna, I need you to get out now because your baby's not coming in the pool, and I need you to get out now.
Yeah, the baby's not coming in the pool. Yeah.
So it wasn't, because I heard her say it's not safe to give birth in the water.
Oh, really? Okay.
But right before she said that, which I didn't hear the last time.
So we don't really know. So this goes back to what we were talking about earlier. It's so interesting.
Right. And it does look like this is either Australia or UK or New Zealand or something like that, in which their protocols might be very different. Sounds like someone needs to take Barbara Harper class or look at some evidence. But that's really common, especially it looks like you said, it's like a hospital ward. And this understanding that it's not safe to give birth in the water, even though most of that theory has been really disputed, is still very prevalent.
I'm wondering, because they were saying at one point, you know, we need to, earlier in the video, that maybe they needed to give her an episiotomy and that they couldn't do it in the water. But then she flipped over and they were saying, oh yeah,
now it's coming.
But then they're like, okay, now you have to get out. So is it because birthing in the water is against their policy, or they believe it's unsafe, or because the baby was stuck? And the music at the end would make you seem that there was an issue, you know. I know, exactly. My heart rate rise. I'm like, they were having her flip over and the music was dun, 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 you know. Like,
but then
were they using the excuse of, we might need to do a little snip to get her out of the tub? Again, because they don't do water births.
Right. I wonder.
Right.
Because the baby's head was not molded very much, like not much molding, and the color was perfect. The color was great.
So it wasn't like baby was sitting there.
Was not in distress. And the baby, it probably had not been in, like, wasn't in the birth canal very long, probably.
Yeah, again, we don't know these things,
Yeah.
but interesting theme so far in these videos is that this like question of, is it are coercive measures to get you out of the tub because they don't want it, it gets against their hospital location and, you know, personal philosophical policies not to birth in the water, or is this the safest thing for the birthing person based on their time, based on this individual instance?
Yeah.
And, you know, really similar. I don't know if you guys have, again, going back to like the Instagram things that are coming up, but there's that thing going around, that video of that doctor lying to the patient about cutting the cord right now.
No, I haven't seen it.
So like today it's been shared on like Badass Mother Birther, you know, everybody. Essentially, long story short, this person, they just delivered, baby's right on their chest. And someone says, who wants to cut the cord? And the mom specifically says, I want to wait. I want it to fully do delayed. And you can tell the OB does this kind of like nonchalant, we cut it 1 minute because if you wait any longer, like the blood drips away from the placenta and goes back into the baby. You wouldn't want that. And it's like, first of all, that's not actually fact, and that doesn't actually happen. And the birthing person is like, you know, she's in labor land. She's like, you can hear the doula say, you can do whatever you want to do. What are the risks of delaying cord clamping? You can hear the doula say, and they're like, you know, and then the doctor's like, it's going to drain all the blood from your baby. And the birthing person's like, I can't remember what I'm supposed to do right now. Like they're just out of it. And they're like, it's really safe to clamp. And so they cut and clamp the cord. And again, this is 60 seconds, which is standard hospital. I mean, every hospital birth I attend, 60 seconds based on ACOG guidelines. So, you know, there's this kind of, how does a doula better advocate for this person when they're up against an OB who is giving non-evidence-based care? But if you say that's actually not evidence-based, you get kicked out of the room. And then you don't know what's going to happen next to that birthing person.
Well, what about can you just advocate her birth plan here states she wants 3 minutes?
Totally.
Like,
and then they continue in with the same thing though. And then it turns into like,
see, you can delay by
just arguing.
Saying, we have this piece of paper here that's her birth plan. And then at least in my doula day, I would always bring the dad in. Do you remember what she wanted? What did she want?
Right.
I always bring the dad in because you don't.
And then there's that challenge too of just like creating an environment of arguing over the birthing body.
Yeah.
While they're laying there postpartum.
Yeah.
And I've had some of my, you know, and I would say earlier in my doula days, I had some of my clients say like, everything was great except when you were arguing with the doctor.
Right.
You know, and I was like, oh, right. Well, I was trying to save your episiotomy, but okay, thanks. You know, and it's like, so in this instance, right, we've seen twice now where the birthing person was laboring really well in the tub. And they got, for one reason or another, pulled out, gone to the bed on hands and knees. And thankfully, in this instance, they flipped or onto their back on the hands and knees. And it's really challenging to really sit back and think, like, was this necessary for safety? Or was this for the comfort of the systematic patriarchal system that is what we're experiencing in most birthing locations and midwives.
Well, and then also it's like from the perspective of these midwives, it's like they want to be able to keep the pool in the hospital, and if they keep breaking the rules and having babies in the tub, then the administration is going to take their tubs away and no one gets to use them to labor in. Yeah, so that's the other thing, because they're thinking of future moms, you know, and nobody
like being the good girl midwife too.
Well, and nobody wants to get out. I mean, a lot of times you don't want to move and you don't want to get out of the tub, and you tell people ahead of time. Like if you told them, let's say if these midwives told them ahead of time, and babies can't be born in the tub, but you have to get on the, you know, so it's different. You know, was she informed? is this a policy? Was she informed of the policy ahead of time and knew that this was like
Right.
part of the deal of having your baby
Right.
Mhm.
So good.
that could have been.
Yeah.
What about you, Becca? I see your face.
I just feel bad that they have to move at that
I know
point.
nobody wants to move.
I know, because again, birth is really fresh in my mind. so I'm almost feeling a little like, like I'm kind of clenching up when they have to do those things, because I'm remembering I was with my last baby that I just had, I was pretty close and I was standing because that was the position that was working best for me. And my midwife, we talked about this after, and she's like, I totally would have let you stay standing and not move. But I was getting to a point where mentally I was struggling to get past the wall I was hitting. And I would go up on my toes and totally clench. She's like, I needed you down so you could like let out. And so I remember she told me, she's like, I need you to kneel down now. And I was like, no, I can't move. And I was like on my toes, clenching onto the back of a chair. And even just kneeling down was so painful. So, but that was necessary. It was totally necessary for me to get my baby out. So I'm really hoping that these women had to do this thing that was so uncomfortable because it was necessary for their safety, not because it was for the comfort of someone else.
And this is like the age-old question of birth and and being with women too, right? Is that real question of, were you on your tiptoes because of that's like intuitively there was a reason why reason why your body did that. We don't know, maybe. Or were you going against because of fear or tension or pain, right? And using a coping technique that was adverse to positive movement, and your midwife was helping you with that, right? Like it's that fine balance between the midwife can be just by being a presence and intervention, or they can be the eagle eye that looks over a birth and says, I know you think that clenching your butt cheeks right now feels like the right thing, but let's try using a lower voice and the kneeling, right? Like, so what we're seeing there is kind of that question. And the same with this whole like situation in the hospital with the cord cutting, right? Like, well, what if there was a reason that doctor needed to cut that cord? Maybe the cord separated from the placenta and we needed to cut that cord, but the doula is like arguing. Yeah. Right? Like,
no, that's not it's not a thing. It's really black and white with that situation. Yeah. There really is absolutely
so
no
hard.
defending.
The doctor's saying the blood is going to drip out of the baby
into the placenta. Yes, like it's going to go back.
And I would say like once a month an OB says that to me.
Yeah,
that's not a thing, correct?
So here's why they say it, right? If they clamp it at 60 seconds, first of all, ACOG's like it reduces jaundice, blah, 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 because there's more blood volume, et cetera. But if they clamp it at that placenta starts to usually figure out that it's like done doing what it needed to do and delivering all that blood to the baby. And so it starts to separate from the uterine wall. So they can do Pitocin and manage traction and deliver the placenta earlier, suture her up and get out of there to the next birth. But if they wait 30 minutes for a placenta, they're just gonna be like sitting around waiting. And that's not what they went to school for. That's, they didn't go to school to be patient and wait on babies. And so usually that's what I see.
At least there used to be the legal argument that once the cord is cut, the baby's the responsibility of the pediatrician. If the baby's still attached, the obstetrician is still liable for everything that happens with the baby. I don't know if that's still the case, but I've been told that was one of the reasons why they want to clamp that cord and send it to the nursery, because then it's no longer the OB's responsibility.
Oh,
that makes sense too.
I don't know if it's still a thing, but
yeah. Goodness gracious.
Wow. That makes sense too. Absolutely. And also, I mean, again, let's play devil's advocate here. If I were an OB, right? Are we reducing, evidence says no, but are we reducing risk of hemorrhage by getting that placenta out sooner? right? If we do managed third stage with Pitocin and traction and get the placenta out during the first 30 minutes to 15 minutes, in high risk situations, yes, it reduces postpartum hemorrhage, but in low risk, healthy birthing people, it has no evidence of actually doing that. And so, but in the hospital, that's high risk people should be. So the policy is not personalized, right? The policy is for people who could hemorrhage. So they do it for everybody.